Hello and welcome everyone to the session on key steps to a successful GPP program. This is Mac Gupta, VP of Product Marketing from WealthEngine, and I'll be your host for this session. With me, I have Greg Workman, who is the Director of Finance and Operations at Spectrum Health Foundation. We are going to talk about Grateful Patient Program, also known as the GPP program. But first, Greg, can you describe your role and give us some more insight in your organization?
Sure. So I thought I'd kind of start about talking about what Spectrum Health is. I notice when I go to a lot of industry conference and people ask me where I'm from, I say Spectrum Health and they kind of nod their heads and then they say, oh, where's that? And they don't actually know what our organization is. So we're based here in the west side of Michigan in Grand Rapids, Michigan. Just a decade ago, we were really, just a couple of hospitals, but we've really advanced the last several years to be more of a comprehensive healthcare system. And our foundation has really developed, alongside the kind of the parallel maturity of the organization as a whole. So over $6 billion in annual revenue, about half of that's from our delivery system, about half of that is from our insurance network, which is called Priority Health. You see to the right there that we've got a standalone children's hospital, it's Helen DeVos Children's Hospital, which is now ranked in the top 50 of many different specialties, about 6 different specialties in U.S. News and World Report. We've got a very centralized development staff, and so one of the benefits of having all of our foundation locations and all the Spectrum Health locations being basically within about 100-mile radius is that we're able to operate very collaboratively. Which, when we get to talking about what we've done from a grateful patient perspective, you'll hear a little bit more about how, the kind of the uniqueness of our system we've been able to leverage. So a key point to measure there. And then, just by the nature of, any of you out there that have children's hospitals probably also are in the same boat where you have a very developed and mature annual giving and grassroots fundraising program. And we're not unique in that. We're a Children's Miracle Network hospital. So that's always been a driver of our fundraising. But really these last several years, as we've matured, we've adopted more of an academic type kind of model, which has allowed us to really advance where we are from an organizational standpoint. So my role, like many of you, I'm sure, is to wear multiple hats. So being Director of Finance and Operations includes everything from finance to fund management to donor relations to reporting, analytics. Get heavily involved in the strategy of the organization, but also, what I probably would say would be, my biggest passion area is really business operations, efficient business operations, and that's where a program like the Grateful Patient and helping to drive strategy really excites me because it's a merger of the analytics side of working with a partner like WealthEngine, working with our developers from Omatic Software to really develop kind of innovative solutions. And then also working with my team in terms of, the CRM strategy that we have in place and how we integrate all three of these together to get us to better fundraising results. So that's really what kind of motivates me and why I'm excited to kind of share some information today.
All right. Awesome. Greg, it's great to have you here. So let's get into our session and start with definitions. Greg, how would you define the GPP program?
For everybody, I feel like Grateful Patient is a buzzword that's been, or I guess more of a buzz phrase that's been out there for such a long period of time. And it means something different to everybody. And I think, what it is really meant to us is when we talk about a Grateful Patient, it's somebody that, if you think about it in an academic setting, you're alumni. So for us, it's really, for us, patients are our alumni. So it's really identifying those alumni of our services that, want to find a way to be able to make a difference and give back to our organization. So that to me really defines what a Grateful Patient is. And then when it becomes, how does it become from just these one-off experiences and maybe things that just kind of happen organically without you doing anything about it, is when it becomes a fundraising program, which is where we're trying to get to, is, when you're adding a layer of intentionality around it. So you're being proactive, you're trying to match those donor interests with the opportunity to give back. You're engaging not just physicians, but the clinicians and other staff across the organization to really be respectful and be looking for those opportunities to kind of create those areas where your alumni are able to give back to you. So to me, when you talk about a program, it's really that comprehensive approach and really being proactive about it.
All right, great. So yeah, that actually clarifies it quite a bit for myself included. So hospitals who want to reach out to people who can donate don't want to reach out to just people who are wealthy, right? I mean, they also want to reach out to people who have the propensity to donate, and that's their interest. So is that one of the factors to consider?
For sure. And what I always, kind of tell my team, because, you go through different iterations with fundraisers and what are they placing priority on? And, the thing that I always, kind of tell our team is, in my view, still the best indicator of what someone is going to do is what they've done in the past. And so that's, really where we kind of put our focus primarily. But it's one of the things, that kind of appealed to me in terms of choosing WealthEngine as our provider for what we'll talk about in terms of what we built from a Grateful Patient solution, is that there is that P2G score. So there's looking at both sides of it. It's not just looking at the asset side, but it's also looking at that propensity side. So, and I think, if there's I assume there's a lot of other healthcare foundations that are listening to this. And so it's not unique for me to say this, but Healthcare offers a lot of great options for donors. One of the challenges is that we offer so many options. So for us, it's not just a matter of, is this donor interested in giving back to children's? Is this donor interested in giving back to, cardiovascular because they might have been a patient there? There's so many more options to that, from, a canine program to, to different community health efforts, to, to cancer, to research, to, would they rather support patient assistance or would they rather support research or innovation? There's all those different things that you have to learn about that individual to be able to, kind of help, give them the best kind of charitable giving experience that they'd like to have. And so that's definitely something to consider. And then even beyond that, I mean, just kind of the reality of the charitable giving landscape is that there's so much competition right now. And so you really have to drill into, just to your point, just being wealthy is not much of an indicator. You really have to, look at the people much deeper than that.
Yes, that definitely makes a lot of sense. I think, and like you pointed out, for us, it's not just the propensity to give to hospitals, and you have to look at very granularly what their interests may be, and what they've done before and what they are likely to do in the future. So that's fantastic. Let's take a little bit of a deeper dive here. What are the most common misconceptions people have about a GPP program?
Right. So I think, it depends if you're talking about people, if you're talking about people in the fundraising industry, if you're talking about clinicians and community members. But so I guess I'll kind of approach it from both sides. I think the most common, misconception among clinicians is, that you're somehow violating, or it's a HIPAA violation and all those kind of things. And so you have to be very sensitive about that and refer back to, the 2012, different guidelines that came out, and make sure you're educating your staff. So that's one of the things that's obviously a misconception. And then I think, within the fundraising industry, and I still feel like this is out there, that people believe that a Grateful Patient program is just about direct mail or direct response, about sending out mass marketing, about sending out email to your alumni or your patients. And to me, that's not what a program is. That can be a tactic that's part of a program, but and I can attest to this just from my experience of talking to a lot of other organizations, and just from our experience, is that a direct mail only strategy is really not going to accomplish much. And I think if you really drill into it, you'll identify that, a direct mail acquisition strategy just geared at your patients is probably going to be less successful than just doing a pure acquisition strategy based off of a direct marketing list. So just to give people some perspective about that. But from my experience, those have been kind of the biggest misconceptions.
Right. I mean, you not only have to understand the individual at a deeper level, you also have to understand what is their choice in terms of channel by which they consume information, and A lot of people, they don't look at mail. I mean, that's not where they are. That's not how they consume information.
Right.
Right. Great. So, Greg, what are different types of approaches that people have taken when planning a GPP program?
Right. So, and it depends. Like everything in the fundraising industry, a lot of what your approach is going to be dictated by is what your resources are. How much staff do you have? How big you are? I mean, that's something I kind of forgot to mention at the kind of outset of talking about Spectrum Health Foundation, is just to let people know that, well, I feel like we're fairly sophisticated. We're a relatively small development team. We've got less than 40 folks that are actually in the foundation, and so for us, everything has to be about efficiency and automation. And so so what you're capable of doing and what kind of program you can have oftentimes depends on what your resources are. But what I've seen is multiple approaches. You see organizations that are very much focused on, like we talked about, the direct mail approach around things like Doctor's Day and those kind of things. But there's also quite a bit of effort that most people take in terms of trying to train their clinicians and physicians to be able to read the cues to kind of advance the program. And so, many healthcare organizations are kind of pursuing that track as one of their kind of primary kind of rollout strategies. For others, I think it's really just more focused about the data. And I think, that's where I was talking about earlier of, the data is only part of it. You've got to have that comprehensive program kind of to get there. And so we're no different than others that we've tried and failed, several times. And that's kind of, why we're talking today a little bit about, what we've tried to create now, which is more of a holistic approach. So that's starting to work for us. Mm-hmm.
All right. I think that sounds great. So there are several approaches, and you share with us what's working for you now based on all of the experience you've gathered over the years. And that's excellent. Yeah. All right. So even so, some in the audience would really like to understand why now. I mean, there's always this, particularly the ones you still building out and thinking of building out a GPP program. They're thinking, what is it that is so important about this program that they should look into it, consider doing such a program. So for those folks, what is it that you would advise them in terms of why this program is really one of the key imperatives for all hospitals?
Right. And so, for us, one of the things that kind of pushed us to say we've got to be more comprehensive about this is that, donors have really been telling us this. So, I mean, we've seen enough scenarios where, the donors themselves or potential donors themselves are going back to their clinicians. And, we're hearing from the clinician about what this potential donor wants to do for their program. So it's almost, for us to some degree for a while, some components of, what our results were almost kind of happening in reverse. So when you see those scenarios, then you realize the greater level of potential. But I think everybody understands, just the financial challenges of the industry and, why creating these opportunities are even more important. An organization that produces a 3% operating margin is a successful one. And we know to grow an organization, to take advantage of the potential innovation out there, to build a research program, to really to create patient assistance programs, to be able to meet the needs of your community from a healthcare standpoint, requires more funding, requires philanthropic funding. And so that's why I think you see the best healthcare systems in the country placing a lot of emphasis on having a strong philanthropic program. And so obviously GPP, is kind of a centerpiece of how you really build, a strong fundraising program. So for us, at least, we're being more donor centric, if we have this type of program, and ultimately we know that that's going to make us also more successful in terms of, what we can raise and how much support we can give our system.
Mm-hmm. Yeah, I like the phrase you used there, donor centricity. I think that makes a lot of sense. So good. So I think this is a really good segue to talk about your own strategy. If you can describe that for us, the strategy that you chose to take, and how is that going so far for you?
Right. So like I kind of hinted in terms of, we have invested really, the last year or so, we have invested a lot to say that, like I said, we're going to be a little bit more comprehensive and more intentional and more proactive. And so we've invested some time working with our developers from Omatic Software, working with WealthEngine to leverage their API to say that, we're not just going to have, kind of one-off efforts. We're going to have really a daily monitoring of what we're doing. So if I can get a little bit nerdy for a bit, I'm going to share with you guys kind of a simplified, daily workflow. I didn't include our entire workflow because it's pretty tricky to get that kind of stuff to fit on a slide with being able to show it to you guys. But just to give you kind of a glimpse of what we've kind of created and what we're working with right now. And this is really just focused on the daily piece of what we've created. But so we utilize as a system Epic as our medical record. And so we're taking the information that we're allowed to have as fundraisers and have that very securely run through an FTP process and into what you can see there with those black kind of people icons. Those are kind of the logo that we use for our CRM. We utilize Blackbaud CRM. So we've got the information flowing in there on a daily basis. At the same time, we've built an integration with WealthEngine's API. So we've really got, an automated process, where our daily census can be screened, can be both matched and screened virtually automatically with very little intervention from us. And then from there, these different workflows can identify, so we've got workflows in terms of, what our criteria is from a P2G rating standpoint, in terms of which track and what we consider not rated versus rated. So we have basically it boiled down to for you guys, basically 4 different tracks in terms of, what would be those automated interactions that happen with our patients on a daily basis. So if they're not in our CRM, which means they're not an existing donor and they're not rated, obviously we still add them to our CRM and we hold for potential targeted direct mail or other efforts, but no further action required with them. If they're not in our CRM and they are rated, then the data is appended, it populates a discovery list. It potentially could go to a prospect huddle review if it met some other criteria. And I apologize, we've got a little bit of a typo there. That second bullet down should say not in CRM and rated. And then if they're already a donor, but they don't have a prospect manager, then there's no further action because we already have a strategy around them. And then if they're a prospect managed donor, then we don't just append the data, but we also notify the PM so that that PM can make a decision, based on what that donor has kind of worked out with them perhaps beforehand, or what patient relations can work out with them. If they, if they'd like to get a note or a visit from the foundation, or those kind of things can happen proactively. So it's not just about the ultimate, end game in terms of the strategy, but it's also about, really what do we do on a daily basis to best serve our existing donors, not just potential future one donors. So that in kind of a nutshell is what we've created. And I think, the part that we're really excited about, at least me personally, from being kind of a technology person, is just the level of automation that we've been able to create with it by working with WealthEngine with a really flexible API. I mean, I think when we got in there and we realized that, virtually almost all the fields that are available in a WealthEngine profile, we could almost automate in terms to be brought into our CRM and appended, automatically. That was really exciting, and really excited to see where it goes for us in terms of, just that level of sophistication that we've kind of brought to our database now.
I think that's great to hear. And so, by the way, I totally own that typo. I did have a follow-on question on this one. So if they're not in CRM and they're not rated, and you add it to the CRM, yeah, and hold it for potential direct mail, what basically allows you to kind of go to the direct mail step? What's the threshold that helps you define that, no, yeah, this is actually going to get mail from us?
Right. So it's really going to be really strategy driven. And so, it's going to depend upon some different factors of, if we've, got an initiative in that clinical area, or we've got, a physician that's got, really, he's got an identified opportunity where there might be, a natural connection to start to appeal to folks on a mass kind of marketing basis. So that's, we want to be really intentional, about how we use that, because we want to, be efficient with our resources. But ultimately, where we are, and this is, we might be different than some others who are listening to the call in terms of, we do have a CRM, where we're allowed to have really unlimited records, without having any database slowness and those kind of things. So we do have some flexibility to basically, kind of have, let our database serve as somewhat of a acquisition holding tank, kind of, so to speak. And so we're securely kind of, building that information hidden behind the scene as almost kind of non-constituent constituents is what we've kind of done there. So it really, to kind of answer your question, I don't know if I'm doing a good job answering it, but it really just kind of depends. And that's one of those things where early stages in the program, we're going to find out as we go, exactly how often we utilize that kind of top right holding tank.
Okay, sounds good. So this is good, and I think it is quite simplified and it's pretty clear. And there's still some learning that will happen. So there's this continuous feedback, so to speak, of learning and improving. And so I think this is fantastic. And can you talk a little bit more about how you are incorporating metrics into all of this, and so that you can measure what's done and then take corrective action if need be?
Right. So, metrics are obviously a little bit tricky when you roll out anything like this. So for us, it's very much focused on, very realistic baselines. And so one of the things that we've really built into there is some accountability around, reporting back to the clinicians in terms of referrals, because, while it's not identified in the daily workflow, we know where we're going to have the most level of successes with referrals. And so we've also built in some workflow for that. And that's where we really identified and put in some really base level metrics to say, regardless of which avenue they come through, if they come through the daily workflow, which is automated, or they come through referrals, we want X number to actually make it through that discovery process into that prospect huddle review. And so that's something that we're putting really defined metrics into. So it's not really at this point individual based, it's really organization based, which we think is kind of a good place for us to start.
Yep, makes sense. All right, so Greg, it clearly, with the API and incorporating the wealth and propensity information, you're creating what we at WealthEngine call Wealth Aware campaign. What kind of lift or what kind of ROI do people see when they create a Wealth Aware campaign relative to just doing things the traditional way?
Yeah, I mean, I think that, every time you're more comprehensive in your approach, you're going to get better results. Might be a simplified way of saying it, but and we talked about this a little bit earlier in terms of, really paying attention to, the both sides of the P2G score for us has been really helpful. And so, in terms of lift, we can only measure the ultimate results in terms of, of what our fundraising is. But even beyond that, we identify, taking this approach where you're really more comprehensive, it gives you, it helps with prioritization, which really obviously helps with efficiency. So I think that's, some of what we're experiencing. It's hard to put an exact ROI on at this point, but it's one of the things we can kind of feel it happening. And so it's kind of why we've developed the strategy we have.
Yeah, and I think you're probably already seeing the benefits of automation in terms of efficiency and making sure that the data is transferred over from one system to another automatically, accurately, and there's no corruption there. So I think there's probably some benefits you can see right away. Whether you can actually measure, put a number to it, and start to benchmark something, and then look at the left, that's another thing, and that's one of the things you're probably very excited about. That look, at some point we'll look back and say we did something good there.
Yeah, and to your point, we're trying to kind of play the long game, right? I mean, we're building for the future. So if you think that there's going to be, immediate results from any type of effort like this, you're kind of setting yourself up for disappointment. But when you get the quick wins and the small wins, it reinforces what you're doing. But I think we can recognize with, even with what our donors are telling us, is being proactive is the way to go. And so we feel like what we're doing now is setting us up, to be successful, 3, 5, 10 years down the line.
Yeah, no, I think that's great, and that's really the way to look at such a program, which is so strategic in nature, is to really play the long game and make sure that you have all your ducks in the row, and make sure you're baselining and continuously learning, and then benchmarking, and then figuring out how we are improving on a continuing basis. So that's fantastic, and a lot of the data and the analytics also improves over a period of time. You can keep fine tuning on top of it, and that's the beauty of these self-learning systems. So, okay, so that's great, Greg. Let's pivot our conversation a little bit and talk about the timing. So again, I'm going back to the group of people who are just taking over a GPP program or just starting one. And is there any advice to them in terms of when it's most appropriate to reach out to people once they leave the hospital? Is timing even important in a GPP program?
I mean, I can't say that it isn't, but I can't say that at least from my experience, have not heard any consensus, on the matter. There's no shortage of, fundraising experts, right? I mean, no shortage of people that are doing webinars like us and telling people that they have the answers to these kind of things. But from my view, I hate to say it depends, because that's not an answer to anything. But I feel like, what might be legitimate is that, from an organizational standpoint, hopefully, your patient relations area, your patient experience area, whatever it is being very intentional about, doing surveys and those kind of things. And so those, to me, I mean, the immediate, role of the foundation could be, just getting yourself included in what they would already receive from a patient relations or patient experience standpoint. That initial touch point feels a lot better to me than, immediately sending some kind of solicitation or those kind of things, right after somebody's had an experience. So, and I think, I mean, obviously it's going to depend on, what area they were, what area they were served by, how complex their care is. It could be things that they're going to be dealing with for years, and so it's hard to really pinpoint, in terms of timing. But I would say, integrate into your patient experience so that, people at least have the opportunity to let you know that they do want to give back, right? I mean, that to me is the kind of the key thing to do from a mass standpoint.
Yeah, I mean, that sounds a little bit like common sense too.
Right.
But you're right, and I think you put it right. And it does depend on the type of service that was provided, and it should be really thought through as part of the patient experience while they are getting into the system, while they are in the system, and as they leave the system and beyond. Right. So that's great, and this kind of insight, Greg, that's truly valuable for our audience. Here's one final question, Greg. What is your advice for someone who just took over the campaign? What can they do tomorrow that will ensure that they're successful in their role?
If you've just started and you don't have any type of program at all, obviously, make those connections within your compliance department. Don't get yourself shut down right off the bat. That's number one. Number two is get the senior leadership of the organization. Get them to understand what you're doing and get them to buy in and be advocates and ambassadors for it. That's kind of number two. From there, it's really, be very patient, be very innovative, identify the partners that you're going to work with to get you there. Organizations like WealthEngine, Nomadic Software, et cetera, that, have had experience with this, that can help you do it from a technology standpoint. Don't forget about making those partnerships in addition to what you need to do internally. But I mean, above all, like I've said a couple of times, it's just, be patient with it. Don't sell that there's going to be immediate results from anything, and just be really intentional about what you do and make it manageable. Make it manageable for your staff. So.
Okay, sounds good. That's very practical advice, Greg. So all of that makes a lot of sense. Greg, thank you very much for shedding some light on the GPP program. I think I learned quite a bit as I listened to you, and I'm pretty sure our audience found it useful as well. We'll wrap up this session, but I wanted to give you one more chance to share any last thoughts that you may want to with our audience today.
I mean, I've said it already, but in terms of just make sure you identify, the partners and what can work for you, and don't undersell what you can do. And that's one of the things that I tell people all the time. And I kind of have already said it, but we're a small team, and we've been able to say, hey, we've got great partners who know how to do this. We've got enough level of knowledge. We've got organization behind what we want to accomplish. If you work with the right people, you can accomplish something that is really way more sophisticated than what much larger organizations might be doing. So just stick with it, and good luck.
Yeah, no, I think Greg, what you just said is very inspiring for people who are just starting, or in fact even have a program that may not be going as well. That just have the right partners, have the conviction of what you can deliver. A small team is not a hindrance.
Right.
Don't let it be, and don't undersell yourself. So I think that's fantastic. What a great way to sign off. I hope everyone enjoyed this conversation and learned from it. Please let us know. I know I did for sure. And also make sure you check out some of the other sessions that we have. Thanks again, Greg. Thanks, everyone.
Thanks.
Bye.